Okay, in this tutorial, we're going to give an overview of the abdomen, pelvis, and perineum and focus on the osteology and answer the what questions. What are the bones and landmarks of the pelvis, and what is the difference between a male and female pelvis? Hello, everyone. My name is Dr. Morton, and let's get started. So the pelvis is merely comprised of two os coxae plus the sacrum plus the pubic symphysis. So here's an anterior view of the pelvis. There's one os coxa, a second os coxa, so two together make two os coxae. Then there's our sacrum, and there's our pubic symphysis. So one os coxa is the pelvic bone. And we blow that up, and each pelvic bone is formed by the fusion of three bones, the ilium, the ischium, and the pubis. So in this medial view of one pelvic bone or os coxa, there's our ilium, there's our ischium, and there's our pubis. So to start, we're going to do landmarks of the pelvic bone, so those three bones together. And so first is the acetabulum. It's a cup-shaped socket of the hip joint. So here we have an anterior view of the pelvis, and there's the acetabulum. That's the socket of the ball and socket joint of your hip, articulates with the head of the femur. Next is the obturator foramen. It's a hole in the os coxa that's covered by a membrane. There's the hole, and there's a drawn obturator membrane. Now that opening at the top transmits the obturator nerve, artery, and vein. So in this anterior view of the pelvis, there I've just drawn in there the obturator nerve, artery, and vein coursing into from the pelvis into the medial compartment of the thigh. Next is the greater sciatic notch. It's formed between the posterior inferior iliac spine and the ischial spine right there. And the greater sciatic notch transmits the piriformis muscle, sciatic nerve, hence the name, and pudendal neurovascular bundles. The lesser sciatic notch is between the ischial spine and the ischial tuberosity right there, and it transmits the pudendal nerve and internal pudendal arteries and veins into the perineum. The pubic symphysis is a band of fibrocartilage that connects our two pubic bones together right there. It's the pubic symphysis. Next is our pelvic inlet. This is a region at the very top between the sacrum arcuate line. It's the superior aperture to the pelvis, and it's between the sacrum arcuate line, the pubic bones, all the way back to the sacrum. And this is the communication between the abdominal cavity into the pelvic cavity. Next is the pelvic outlet. This is the inferior aperture of the pelvis, and so it courses from pubic symphysis all the way down to the coccyx and back. This is now the communication outside, or the inferior part, and it's through the rectum and also the urethra, and in females we add the vaginal orifice. Okay. Now we're going to talk about the bony landmarks of the ilium. So the first bony landmark is the iliac crest. It's a thickened superior rim for muscle attachment all along the top. This is an easily palpable landmark in surface anatomy. Next is the iliac fossa. It's a concave surface on the front of the ilium here, and that's the origin of our iliacus muscle. The anterior superior iliac spine, or ASIS, is an anterior bony prominence on the iliac crest there, and it's an attachment for our inguinal ligament and our sartorius muscle. Next is the anterior inferior iliac spine. It's a bony landmark below the ASIS there, and this is where our rectus femoris muscle arises from. Our posterior superior iliac spine is a posterior bony prominence on the iliac crest, located there and there. And next is our posterior inferior iliac spine, and it's a posterior bony prominence below the posterior superior iliac spine. Okay. Next, we're going to talk about the ischium and its bony landmarks. First, the ischial tuberosity. It's a large prominence on the bottom of the pelvis, also known as your sits bone, because there shows this is the part that if you're actually sitting down watching this video tutorial, that's the part of your derriere that's touching your seat. Next is the ischial spine. It separates the greater and lesser sciatic notch. So there's the ischial spine, and there's the greater and lesser sciatic notch. Next we have our ischial ramus, and this is a branch that joins the ischium to the pubis. So there's our ischium, there's our pubis, and there outlined is the ischial ramus. And also in that anterior view we can see it. So let's now talk about the pubis and its landmarks. First, the superior pubic ramus. It's a bony projection that connects with the acetabulum. So there's our superior pubic ramus, and there it is in this view. Next is our pubic tubercle. It's a rounded projection on the superior pubic ramus, there and there. And then our inferior pubic ramus. It's a bony projection that connects with the ischium. There's our inferior pubic ramus. So now the ischiopubic ramus is an inferior pubic ramus plus the ischioramus. So there's our inferior pubic ramus and our ischioramus, and together they make the ischiopubic, or sometimes known as the conjoint ramus. All right, so let's talk about some sex differences in the pelvis. So the pelvic inlet is, in the female, it's more circular in shape, like that. In contrast, the male pelvic inlet is more heart-shaped, like that. Next is the pubic arch. In females, it's approximately 80 degrees. So in this anterior view, there it is, 80 degrees. And a way to estimate it is if you use your index and thumb, that's the angle of the pubic arch in a female. In males, it's about 60 degrees. So here it is in male, about 60 degrees it's less. And a way to approximate that is it's the angle between your index and middle finger. And that, my friends, is an overview of the osteology of the abdomen, pelvis, and perineum.